Hello everyone, I'm Dr. Geetika Paul. I'm a dermatologist based in Phase 10 Mohali. So, with summers coming up, I thought this is the right time to discuss regarding fungal infections with my viewers. Fungal infections are very common in the coming season, especially in hot and humid weather. These fungal infections are very common. We also call them tinea infections or the ringworm infections. These are basically caused by an overgrowth of fungus over the areas of the body which are more prone to warmth and the areas of the body in which there is more of sweating. So these infections are more common in the underarms, the axilla, the groin region, even between the toe web spaces in our feet. These type of infections are very common. Most of the people complain of redness in these areas along with development of circular patches. They can be itchy rashes. Some might even notice extreme dryness of skin in the folds, or in some cases there can be maceration of skin also. So any kind of these symptoms, if you're developing any kind of redness, any kind of rashes localized especially to the folds of the body and associated with itching, you should definitely be cautious and we need to rule out a fungal infection. In most cases these infections start from the skin body folds because those are the areas where we have more sweating and these areas are warm. But in extensive cases, if the patient is not managed well, these infections can spread even to the rest of the body. So what are the do's and the don'ts, or the things which we can take care of to prevent such infections? Now, one need to know that these infections develop because these areas of the body are more prone to sweating and they remain moist. So the most important thing is to keep these areas dry. After you take bath, you should definitely dry these areas well. Wear cotton clothes, wear cotton undergarments as far as possible in the warm weather. Do not apply any kind of oil or cold creams to these areas. Using antifungal dusting powder definitely helps, especially during the summer months and in people who are more prone to sweating. So this will keep your areas dry and it will prevent any kind of fungal overgrowth. Now the most important thing, because the problem that we as doctors, as skin specialists are facing nowadays is that of resistance to this fungus. Now most of the people, when they develop any kind of itching or rashes in our body folds or in our private areas, they just go to a chemist and they buy some OTC, over the counter medicines, especially steroid creams. So all these combination creams which are available with the chemist, most of these contain steroids. So people are used to applying these creams whenever they develop any kind of skin problems. Now when you apply these creams over the fungal infections, now it is leading to a very serious issue. People definitely feel there is improvement when they apply these steroidal creams over their ringworm infections, because there is a symptomatic relief. There is decrease in redness, there is decrease in itching, but actually what is happening is this fungus usually remains on the superficial layers of our skin. But when we apply these steroid creams, the fungus tends to go deeper. It starts growing inwards, it grows deeper. So although we feel that we're getting better, the redness in the ringworm patches tends to decrease, the itching tends to decrease, but the fungus is actually multiplying. It's going deeper and it is spreading. Nowadays we are definitely facing a problem of resistance. Medicines are not acting upon this fungus. There are very limited options available. So my request to all my viewers is, just in case any of you develop any kind of fungal infections of the skin, of the folds, which is not going off its own, avoid using any kind of steroidal creams and definitely go and see a nearby skin specialist so that proper diagnosis can be made and you can be started on specific treatment for your fungal infections. Thank you.